Hi, I'm Donna Norton, National Healthcare Campaign Director from MomsRising.org, and I'm here today with Senator Merkley from Oregon. Thanks so much for being here with us today to answer questions from Moms Rising members.
It's great to be with you.
Well, our first question is from a Moms Rising member from Portland, and she asks, I've seen the positive health effects and cost savings from breastfeeding with my own kids, aged 5 and 9 now. And I heard you wrote some legislation to promote breastfeeding that just passed through health reform. Can you tell me more about what that is?
Well, I can. I want to share a little background, though, and that is a mom came to me when I was in 2005, when I was Democratic leader, and described the challenge of going back to work and not being able to have privacy or flexibility of time to be able to express milk. And this resonated for me because my wife, Mary, is a nurse. And when she went back to work at a hospital, she had great difficulty getting the flexibility and the privacy. So if it's hard in a hospital setting, how much more so everywhere else? And so in 2005, we were not successful in establishing a bill that had those features: time flexibility, unpaid break time, and second of all, privacy. But in 2007, we did get it passed. And for me, that was a terrific victory, common sense victory, bipartisan victory, pro-family victory. So when I kicked off my campaign for the U.S. Senate, it was at a gathering celebrating that bill. And I said, if I was elected to the Senate, I would fight to get that same legislation passed for moms across America. And so that was the foundation for my involvement, and I was so pleased to be able to sponsor the bill this year that has those same provisions, flexibility in breaks and privacy, and it does allow an exemption for the smallest firms, a hardship exemption. But in Oregon, the hardship exemption was available, and firms have explored it, but they've always found, upon talking to the state committee on the ways that they can provide privacy and flexibility, they have never, not a single firm has adopted or taken the hardship exemption. Every single firm has said, we can do this for our working mothers. And I think that's what's going to happen at the national level as well.
Thank you. Well, on behalf of Moms Rising members, we really thank you for that.
Well, you're welcome.
Our next question comes from another Oregon member. And she asks, I'm wondering what incentives there are in health reform to actually prevent diseases before they start.
Well, there's quite a bit in this bill that addresses that. The first is that preventive services are provided for, that they will have to be in insurance plans, new insurance plans. The second is that those insurance plans will not be able to charge a copay for prevention or a deductible for prevention. So it really says, yes, let's get health issues addressed up front before they become more serious. The bill also provides healthy choice incentives, and this allows firms to be able to say, we will provide incentives to our employees to take on some of the difficult, expensive diseases, be it hypertension, be it diabetes, obesity, smoking, so that they will not only have higher quality of life, but they'll have reduced expenses, which translates into reduced expenses for everybody in the plan. So it's both good for health and good for reducing healthcare costs. And then for seniors, we have free annual wellness checkups. And so that's an important component as well. All those things will make us, allow us to spend our healthcare dollars much more wisely and improve quality of health for Americans.
Okay, well, thank you. And thank you so much for taking the time to answer questions from our Oregon Moms Rising members. And,
I'm pleased to do it.
And thanks for all the work you do on behalf of America's families.
You're welcome. You're welcome.
Thanks.